One of the more commonly asked questions to my patients while they're in their clinic is, what do I do with a meniscus tear and what does the surgical intervention involve? The surgical intervention involved is based upon where the tear occurs. If the tear is degenerative or it's in the central part of the meniscus, the treatment in general is to take that piece of meniscus which is getting caught in the patient's knee out. We do not take the entire meniscus out. We only take the portion with which is pathologic and causing the patient's problem. There are times the meniscus tear is in the back of the knee or where there is a good blood supply. In that area where there is a good blood supply, the treatment for that meniscus tear is to fix it. The difference is that the recovery takes a lot longer and that our goal is to preserve as much of the meniscus as possible. There are times patients come in who have had previous arthroscopic intervention and have missing large portions of their meniscus. And the question comes in, is there something that we can do about that? Well, the answer to that is that yes, there are things that we can do for this. However, it may involve more than just what are we doing with their meniscus tissue. First and foremost, we have to take a look at the entire patient's body geometry and see whether or not they're aligned appropriately, because the most common cause of continued pain is bad alignment, and we need to fix that alignment before we can take care of the meniscal problem. If indeed the patient has a loss of the meniscus which is very significant, we do have the ability now to place new artificial menisci into the areas of defect if indeed they have good alignment. Those treatments can take a long time for the patients to get better, and as time is progressing, we're getting better in terms of coming up with newer techniques to replace patients who are missing large segments of their meniscus.